Hello, my name is Kathy Quarles-Moore, and I'm an associate professor at the University of South Carolina College of Pharmacy. I'm also a practicing independent community pharmacist, and today I'm going to be guiding you through some of the top 300 drugs that we use in community pharmacy.
This section includes cardiovascular drugs. These drugs are medications that are used to treat high blood pressure, hypertension, and maybe heart failure and some other conditions. But these are just a few of the medications and disease states that these medications treat.
Let's go on to our thiazide diuretics. Chlorthalidone, the generic name for Thalidone, or Hydralazine. That's another name that's not listed, but Hydralazine is another name. One of the indications, or the indication, is hypertension. And the side effect would be photosensitivity, impotence, electrolyte abnormalities, and an increase in LDL, blood glucose, and triglycerides. The thiazide in this chlorthalidone could be contraindicated in sulfa allergies. Now, I'm not saying everybody with a sulfa allergy has a problem with it, but I would be very careful. So just watch that. If they have a sulfa allergy, I would proceed with caution. I would maybe call the doctor or practitioner and make sure we can give this. Another thiazide diuretic is hydrochlorothiazide, or HCTZ, but it's hydrochlorothiazide. You can kind of say it with a rhythm if you really want to, and that'll help you remember it. The oral version of this, the brand name is Oretic or Microzide. And the common indication is hypertension. It is a diuretic, so it makes you go to the bathroom, just like the chlorthalidone does. So one thing I would tell my patients is they need to take it early in the morning because they don't want to stay up all night going to the bathroom. This one is also contraindicated in sulfa allergy. Now, not everybody that has a sulfa allergy has to stay away from this, but I would be very cautious about it. Side effects are very similar to the chlorthalidone. Photosensitivity, impotence, electrolyte abnormalities, increases LDL, blood glucose, and triglycerides. Our next thiazide is metazoline, and the common indication is hypertension. The brand name is Digoxin. It also could be contraindicated in sulfa allergy, and it has exactly the same side effects as our other thiazides. We want to take this one early in the morning because we'll be going to the bathroom, and you want to make sure you tell your patients that you don't want to take it later in the day. And I'm telling you, if they don't know it, they may take it at another time, but you want to warn them, let them know. Good counseling point. Let's move on to our potassium-sparing diuretics and the thiazide diuretic combos. Triamterene hydrochlorothiazide. You see the HCTZ, I've abbreviated it because it's hard to say hydrochlorothiazide. So we're talking about triamterene HCTZ. The brand name is Diazide or Maxide, and it's used for, the common indication is hypertension. And some of the side effects would be increased serum creatinine, dizziness, and hyperkalemia. This one is potassium sparing, so therefore you have to watch that potassium. The important thing to tell your patients that are taking this, they might even want to look at the no salt and the salts that contain potassium in them, because that may raise their potassium levels, and you want to be very careful. You see the monitoring notes, monitor blood pressure, potassium, renal function, and fluid status. Very important. This one you'd want to take in the morning as well because it can cause you to go to the bathroom. That's what we wanted to do. All right, let's look at non-selective aldosterone receptor antagonist potassium-sparing diuretics. Spironolactone. Spironolactone's brand name is Aldactone. Caraspir, which is an oral suspension, and its common indication is heart failure with reduced ejection fraction, HFrEF, hypertension, edema due to cirrhosis, and it has some side effects. Hyperkalemia, like we talked about with the other ones, it can raise the potassium, increase serum creatinine, gynecomastia in males, and this is a very huge side effect. In breast tenderness. Sometimes men that take this for heart failure will come in and they'll notice that their breasts are enlarging and they're very tender. And I like to tell them, well, wait a minute, we need to talk to the practitioner about this because we might want to change it to something else, and we have something else that we can change it to, a Pleuronone, but which may not have the side effects just like the spironolactone. If you look, again, we need to monitor blood pressure, potassium, serum creatinine, and fluid status. Let's look at the loop diuretics. Diuretics are all drugs that make you go to the bathroom. They make you pee. So furosemides, oral dosing, and the IV is Lasix, brand name Lasix. And you know, it's really cool. The reason it's called Lasix is it lasts 6 hours. Get it? One of the common indications is heart failure and hypertension. It can cause some side effects, some electrolyte abnormalities, metabolic acidosis, orthostatic hypotension, photosensitivity, and ototoxicity. These are important to tell your patients because when they're taking a diuretic, sometimes they don't understand that there are some side effects that are very important to tell them. Again, take this in the morning because you will go to the bathroom. Another loop diuretic that we're going to talk about is torsemide, the brand name Demodex. This is for heart failure, fluid overload, and some of the side effects would be electrolyte abnormalities, ototoxicity, orthostatic hypotension, and photosensitivity, just like the furosemide. You notice the semide, furosemide, torsemide, loop diuretics. Okay, let's talk about another loop diuretic, antihypertensive, Bumetanide. The brand name is Bumex. This comes in 2 forms, PO and IV. The indication is for hypertension, just like the other diuretics, the other loop diuretics. It does make you go to the bathroom, and the side effects are the same: increased serum creatinine, dizziness, and hyperkalemia. It does have a drug interaction with lithium. Angiotensin-converting enzyme, or ACE inhibitors, which are also antihypertensives. This is a cool class of drugs. Oh, it's a cool class of drugs. So let's look at the first one, Enalapril. The brand name is Vasotec. And an indication for Enalapril is hypertension and heart failure. One of the biggest side effects of any ACE inhibitor, and you notice the pril on the end, we're going to see that there's a pattern there. Dry cough, hypotension, hyperkalemia, because it spares the potassium in the body, increased serum creatinine, and dizziness. So for this one, you would want to monitor blood pressure and potassium and avoid the salt substitutes like we talked about earlier that contain potassium. So it does have a black box warning. Fetal toxicity is known to occur with the ACEs, so you do not want to use these in pregnancy. And there's also a contraindication with a history of angioedema. Very important. Ramipril, generic name for the brand name Altace, and it is used for hypertension, heart failure, same thing. It's an ACE inhibitor, so the side effects are the same. You want to make sure that with the ACE inhibitors, you don't want to use them with the ARBs or the ARNIs that we're going to talk about in a little bit, but still you want to look at the black box warning and the warning and contraindications, which are the same with all ACE inhibitors. The PRILs, ACE inhibitors, angiotensin converting enzyme inhibitor. Quinapril, brand name is Acupril. Another name with a hydrochlorothiazide combination is Acuretic, and it's indicated for hypertension and heart failure. It also can cause dry cough, hypotension, hyperkalemia, increased serum creatinine, and dizziness. This one will make you go to the bathroom if you use with the combo, the Acuretic, so that one you need to take in the morning. The Acupril, not necessarily, but probably not a bad idea, but especially the one with the hydrochlorothiazide combination, the HCTZ. Benazepril, the brand name Lotensin, and the combination with HCTZ is Lotensin HCT. It's used for the same thing, hypertension and heart failure. It's an ACE inhibitor, antihypertensive. And if you look, you have the side effects the same: dry cough, hypertension, hyperkalemia, increased serum creatinine, and dizziness. Lisinopril, brand name Zestril. It's used in combination sometimes with HCTZ, which is called Zestiretic. And it also is used for hypertension and heart failure. And if you look, the side effects are the same, the black box warnings are the same, and the monitoring parameters are the same. Next, we're going to another group of drugs called the angiotensin receptor blockers, or the ARBs, which are antihypertensives. One thing I want to say about these drugs, sometimes if the ACE inhibitors cause a cough, we generally tend to go to the ARBs as a replacement because a dry cough is not as prevalent in the ARBs. Could happen, but not as prevalent. So Valsartan's brand name is Diovan, and it can be used in combination with HCTZ, Diovan HCT, and it's indicated for hypertension. Now, you notice, like I said, dry cough could occur, but it's really not as common in the ARBs as it is in the ACEs. But it can cause hypotension, hyperkalemia, increased serum creatinine, and dizziness. So a lot of the side effects are the same, but it seems that the dry cough is not as prevalent. And look at the black box warnings. They are also the same, and the warnings and contraindications and the monitoring parameters in the ARBs are the same as the ACEs. Telmisartan. The brand name is Mycardis. The brand name with hydrochlorothiazide is Mycardis HCT. It is used for hypertension, and it has some of the very same side effects as the other ARBs, black box warnings, contraindications, and monitoring parameters. One time a student told me something, I really liked it. Telmisartan. He said, "Tell me sartan good." I thought that was funny. Ibosartan. The brand name is Avapro. And you notice these sartans, okay? Avapro. The oral combination with hydrochlorothiazide is Avalide. And again, it is indicated for hypertension. It has some of the same side effects, black box warnings and contraindications as the other ARBs and ACEs, and the same monitoring parameters. Olmesartan. The oral version is named Benacar, called Benacar, the brand name. And with the combination of HCTZ is Benacar HCT. It's also indicated for hypertension, same side effects as the other ARBs, same black box warnings and contraindications and monitoring parameters. Losartan, brand name is Cozar. Now, the combination with hydrochlorothiazide is not Cozar HCT or anything like that. It's Hyzar. Hypertension, Hyzar. You get it? And some of the side effects are the same as the other ARBs and ACE inhibitors. Same side effects, black box warnings and contraindications, and monitoring parameters. Candesartan. The brand name's Atacand. The brand with HCTZ involved or included in it was Atacand HCT. Sartan. ARBs, Sartan. Indications, again, hypertension, same side effects potentially, black box warnings and contraindications, and monitoring parameters. All right, moving to the next class. We're going to alpha-1 blockers, antihypertensives. Doxazosin Mesylate. The brand name is Cardura. Common indication is BPH, benign prostatic hypertrophy. Some of the side effects would be dizziness, fatigue, headache, abnormal ejaculation, fluid retention. And this one, actually, the first dose can cause orthostasis or really a lot of dizziness. And it can also leave a ghost shell in the stool. So that's important to let your patients know that. Very important, because they need to know these things. Another one is Terazosin. The brand name is Hytrin. Common indication, again, is BPH. Side effects are very much the same. The warnings and contraindications are the same. And the notes are the same for the first effect of orthostasis or dizziness. And it's really not recommended for hypertension monotherapy. Okay, let's talk about the angiotensin receptor neprilysin inhibitors, or ARNIs. You see that? ARNI. Sacubitril Valsartan is the generic name for the brand name Entresto. And you've seen Valsartan before. That's an ARB, isn't it? Sartan, ARB? But we've added sacubitril. It's indicated for heart failure, and some of the side effects are dry cough, hypotension, hyperkalemia, increased serum creatinine, and dizziness. A quick note to this, it decreases the mortality in heart failure in HFrEF, but you got to monitor the potassium and the blood pressure. So this drug is not to be taken with ACEs, ARBs, or lithium. And you have your black box warnings, fetal toxicity, to discontinue it while you're pregnant, just like the ACEs and the ARBs. And don't take this within 36 hours of an ACE inhibitor. This is when you're having somebody convert maybe to an ACE to an ARNI. You want to make sure you wait that 36 hours. It's called a washout period. So be careful with that. Alpha-2 agonist antihypertensives. Clonidine, the generic name for Catapres or Capve. There's also a patch called Catapres TTS. This is indicated for hypertension. And some of the side effects would be dry mouth and dizziness, fatigue, somnolence, impotence, behavioral changes. These tend to cause a little bit more dizziness and dry mouth than some of the others. The thing to let your patients know that they can get some rebound hypertension if they stop it quickly. They need to taper it over 2 to 4 days, and they really need to get some help with doing that. Let's look at the antiarrhythmic agent, class 3, Amiodarone, generic name for the brand name Quarterone. The common indication for this is arrhythmias, and some of the side effects would be hypotension, bradycardia, photosensitivity, drug-induced lupus erythematosus, and if you look, the black box warning is pulmonary toxicity and hepatotoxicity. Very important to note that. Also, the warnings and contraindications, any iodine hypersensitivity, you would not want to take this drug. Second and third degree heart block, cardiogenic shock, be careful. And you need to avoid grapefruit, very important with this drug. This drug really needs to be counseled on very extensively when you have a patient that starts on this drug. Sotalol, the generic name for beta-pace or Sorine. It is also used for arrhythmias. The side effects of this drug are palpitations, bradycardia, dizziness, fatigue, and heart failure. And if you look at some of the black box warnings, they're very similar to the one we just talked about. So we want to look at that. QT prolongation and also second to third degree heart block, cardiogenic shock. You want to be very careful with this drug too. Let's look at the antiarrhythmic agent class 1C as flecainide acetate. The brand name is Tambicor. And the common indication for it is arrhythmias, just like the others. And this drug has some side effects that are a little different. Visual disturbances. Sometimes you see things that you are like, wait a minute, this is important to tell your patient this. Because what if they saw lights or they have some visual disturbances and they didn't know that the drug was causing it? Important to know. Dyspnea, which is trouble breathing, dizziness, and also you want to avoid this drug with severe hepatic impairment. The next drug is an antiarrhythmic agent, a cardiac glycoside, which it's been around for a long time. It's generic Digoxin. The brand name is Lunoxin, and it's used, the indications for arrhythmias and heart failure. Some of the side effects are nausea and vomiting, bradycardia, loss of appetite, delirium, and visual disturbances. Sometimes with this drug, you'll have visual disturbances where you see greenish yellow halos. Important to let your patients know about that. And it has some drug interactions that are important to note. And also, it's contraindicated in ventricular fibrillation and second to third degree heart block without a pacemaker. Fibric acid derivative, antihyperlipidemic, fenofibrate, the generic for the Tricor tablet, the Triplex capsule, and the Antaramicronized capsule. The common indication for this drug, the fenofibrate, is dyslipidemia. The side effect for this drug, really the major one and the only one, is increased LFTs, the liver functions. So this is important to note that if you take the fenofibrate with a statin, you could get an increased risk of myopathy. Important to know that. And sometimes when you're actually filling this prescription, it'll pop up every single time. So it wants to remind you to counsel your patient on this. Quick note, it can decrease the triglycerides, but it can also lower the LDL when triglycerides are high. Gemfibrozil, Lopid. It's also a fibric acid derivative, antihyperlipidemic. Common indication, dyslipidemia. Side effects, increased LFTs and dyspepsia. Very similar to the fenofibrate that we just talked about. You don't want to necessarily use this with statins because you get an increased risk of myopathy and rhabdomyolysis. Very important drug interaction that you need to note. All right, let's talk about vitamin 3, which is also our antilipidemic agent, niacin, the generic name for Niaspan. And the indication for this one is dyslipidemia. This has been around a long time. Now, one of the main side effects of this drug is flushing. And if you've ever taken or seen anybody or talked to anybody that's taken it, that flushing comes on quickly and they'll be like, "Ooh, I don't know if I can stand this." Sometimes if they take an aspirin, like a 325 milligram aspirin, if they are able to do that, that will decrease the flushing side effect. Sometimes you get pruritus, vomiting, and diarrhea with the niacin. I would tell people to take it at bedtime, patients to take it at bedtime with a low-fat snack. And if you look at the warnings and contraindications, it's got some rhabdomyolysis, hepatotoxicity, increased blood glucose, and increased uric acid. So we maybe have some agents that might be a little better to treat depending on your patient. There again, it depends on your patient. Let's look at some HMG-CoA reductase inhibitors, or anti-hyperlipidemics. Let's look at our statin class. Atorvastatin. Notice statin. The brand name is Lipitor, and the common indication is dyslipidemia. Some of the side effects, myalgias and myopathies, also diarrhea. This can be taken any time of the day. It has an interaction with grapefruit and gemfibrozil. We talked about gemfibrozil earlier, but we didn't talk about grapefruit. So this one, you don't want to take grapefruit along with it. Do not use the statins, any statin, with pregnancy or severe liver disease. Here's another HMG-CoA reductase inhibitor, or a statin. It is called lovastatin. The brand name is Mevacor, and it's indicated for dyslipidemia, just like the atorvastatin. Same side effects, same drug interactions. Now, this one is better to maybe take with the evening meal or before bedtime. Okay? That's the difference. Another HMG-CoA reductase inhibitor is pravastatin, another statin. The brand name is Pravachol, and it is used for dyslipidemia. And note, the side effects are the same, and the warning and contraindications are the same. This one also should be taken with the evening meal or before bedtime. Right on down the list of the statins, another HMG-CoA reductase inhibitor, anti-hyperlipidemic, is rosuvastatin. The brand name is Crestor. The common indication is dyslipidemia. The side effects are myalgia, myopathy, and diarrhea. This one can be taken any time of the day, and it generally has less side effects than the other statins. Good to note. Make a note. Still can't take it with grapefruit or gemfibrozil, but it does have less side effects. Even though it says it has the myalgia, myopathies, and diarrhea, it occurs less frequently. Another statin, HMG-CoA reductase inhibitor, anti-hyperlipidemic, simvastatin. The brand name is Zocor. It is indicated for dyslipidemia, and it has the same side effects, myalgia, myopathy, and diarrhea. This one you need to take with the evening meal or before bedtime. 2-acetidinone anti-hyperlipidemic agent, Ezetimibe. The brand name is Zetia, and this one is for dyslipidemia. It's got the side effect of myalgia, and it decreases the LDL and triglycerides. But it also has contraindications that go along with it. Rhabdomyolysis when you use it with a statin, and myopathy. But sometimes this is used with statins. Bile acid sequestrant, anti-lipidemic agent, Colesevelam. Brand name, Welchol. The common indication is dyslipidemia. Some of the side effects of this one, constipation, abdominal pain, cramping, bloating, and gas. This one decreases LDL, and it increases the HDL and triglycerides. One of the contraindications or warnings would be bowel obstruction. Sometimes they'll use this if patients have a lot of diarrhea. They will use the Welchol with that. So this one too, you might want to note that this one can decrease the absorption of fat-soluble vitamins. Important thing to counsel your patients on. Let's look at beta blockers. Beta-1 selective. Nebivolol, or brand name Bostolic, common indications, hypertension. The side effects would be bradycardia, hypotension, fatigue, impotence, or dizziness. One thing to note about this too, you want to make sure that you note there's some drug interactions with insulin, sulfonylureas, and other drugs that slow the heart rates. Also, do not discontinue the therapy abruptly. We have had some other drugs like this that you have to taper them off. This is important to let your patients know that. Sometimes patients will tend to just totally stop something because they don't feel well, because these beta blockers sometimes can make them feel tired. So like, I'm stopping everything. And if they've been taking it a while, they need to taper off of this. This also may mask the symptoms of hypoglycemia. Good to note. Here's another beta blocker, beta 1 selective, Atenolol. You notice the olols? Beta blockers. The brand name is Tenormin, and if you put it with Chlorthalidone, which is, remember that? Chlorthalidone is what? A diuretic? Yes, we learned that earlier. That's very good. It's called tenoretic. Some of the side effects would be bradycardia, hypotension, fatigue, impotence, and dizziness. So this has some of the same drug interactions, same notes, and same warnings and contraindications. Again, beta blockers, beta 1 selective, metoprolol, beta blocker. You get it? Brand name is Toprol XL, and it's used for hypertension and heart failure. Some of the side effects, same as the other, bradycardia, hypotension, fatigue, impotence, dizziness. The warnings and contraindications are the same, and the drug interactions are the same as well. You might want to take this one with a little bit of food or right after you eat something. The next beta blocker, beta 1 selective, is metoprolol tartrate, low pressure. Low pressure. You know what's cool about low pressure, the brand name? You can see what the drug is used for in that name. Low blood pressure. It lowers the blood pressure. Low pressure. Get it? And the indication is, we know it already because we figured it out by the brand name, hypertension. Some of the side effects, bradycardia, hypotension, fatigue, impotence, and dizziness, same as the others. The next beta blocker, beta 1 selective, Bisoprolol. Bisoprolol. The brand name is Zebeta. Now there is one with a combination with hydrochlorothiazide. Zyac is the brand name. And this drug is used for hypertension and in heart failure. It has some of the same side effects, the bradycardia, hypotension, fatigue, impotence, dizziness, and it has the same drug interactions and warning and contraindications. But remember, we're seeing with the beta blockers, all the beta blockers are prolols, olols, all the olols are beta blockers. Note to self. Now here's some beta blockers that are non-selective. There's one, propranolol. It still has the olol and it's a beta blocker, but it's a non-selective beta blocker. So the brand name for propranolol, there are several, Enderol LA, and I didn't say this earlier, LA is long-acting, Enalapril XL, extended acting, extended release, extended acting. Indication for this is hypertension. Now, these are kind of cool. They are used for migraine prophylaxis and performance anxiety. A lot of people, when they get anxious before they speak or talk to a group, they'll take propranolol instead of something else like benzodiazepine. So this is good to note. It still has some of the same side effects, the bradycardia, hypotension, fatigue, impotence, and dizziness, but it's not just used for hypertension. Cool to note. Here's another beta blocker that's non-selective, but it's an alpha-1 blocker. It's Carvedilol. The brand name is Coreg. It's used for hypertension and heart failure, and it has some of the same side effects as the other beta blockers. And I'm not going to go through them again because you already know them. Drug interactions are the same. The warning and the contraindications are similar. This one is definitely contraindicated with asthma. Very careful, very careful. Here's another beta blocker that's non-selective, an alpha-1 blocker. It is called Labetalol. The brand name is Normodine. The indication is hypertension, but it's still got that olol in it. Even though it's spelled A-L-O-L, you can tell it's a beta blocker, but it's just an alpha blocker. That A would indicate A for alpha. See if you can pick out some of these things in these little cool quips that you can learn a drug. And that's what I always try to do. A for alpha. Okay, we know it's a beta blocker because it's the olol, but the alpha-1 blocker, the A makes an alpha. I'm trying to help you with that. The indications: hypertension, side effects: bradycardia, hypotension, fatigue, impotence, and dizziness. Same thing. This one too is contraindicated in asthma. Now we're going to talk about a dihydrocalcium channel blocker. The generic name is nifedipine, and the brand name is Procardia. It's indicated for hypertension, and some side effects are peripheral edema, headache, gingival hyperplasia, palpitations, reflex tachycardia, And note, there is a hypotension risk. But other note, the ER formulation is a drug of choice in pregnancy. Pretty cool to know, isn't it? Another dihydrocalcium channel blocker is something called amlodipine. The brand name is Norvasc. The indication is for hypertension, just like our other dihydrocalcium channel blocker. Some of the side effects, the same: peripheral edema, headache, gingival hyperplasia, palpitations, reflex tachycardia, and there is a hypotension risk. Now here's a really neat drug. It's a dihydrocalcium channel blocker with an ACE inhibitor. Remember when we talked about ACE inhibitors? Which one is the ACE inhibitor? Benazepril. So we've got the amlodipine, which is the dihydrocalcium channel blocker, and the ACE inhibitor, which is the Benazepril, and that's the generic name. It's a combo, and the brand name is Lotrel, and it is used for hypertension as well as heart failure. Some of the side effects would be the same that you saw with the ACE inhibitors and the dihydrocalcium channel blockers. So, dry cough, remember that? Hypotension, hyperkalemia, increased serum creatinine, and peripheral edema. This one is one you would also have to avoid salt substitutes that contain potassium. And look at your black box warning: fetal toxicity, discontinue while pregnant. So we're going back a little bit but bringing it forward with the combination. Now here is a dihydrocalcium channel blocker with an ARB. And remember when we talked about the ARB, the Artin, the Sartan, Olmesartan, and the dihydrocalcium channel blocker, the amlodipine. So what we've got here is the brand name Azor. This is a triplet. They've got the amlodipine, Olmesartan, and hydrochlorothiazide. So they've put the diuretic in there too. The indication is hypertension, and we have the side effects: dry cough, hypotension, hyperkalemia, increased serum creatinine, and dizziness. And notice the drug interactions: ACEs, ARNIs, and lithium. Here's another dihydrocalcium channel blocker with an ARB. It's called amlodipine and Valsartan. The Valsartan is what? If you said ARB, you're getting this right. Amlodipine is, yes, the dihydrocalcium channel blocker. So the brand name of this product is X-Forge. Then they've done the same thing we did with the last one. They added the hydrochlorothiazide, so it's called X-Forge HCT. And we know that the HCT is for the hydrochlorothiazide with the same side effects that we saw earlier: dry cough, hypotension, hyperkalemia, increased serum creatinine, dizziness. Now we're going to talk about some non-dihydrocalcium channel blockers. This one is Diltiazem, and the brand names are Cardiazem. You have SR, CD, and LA. Then you have Tiazac. This is for arrhythmias, the indication arrhythmias, and hypertension. Some of the side effects are edema, constipation, but that's more with verapamil, and I've put this on this slide, and gingival hyperplasia. Here's another one, a non-dihydrocalcium channel blocker. It's verapamil, brand name Kalan or Kalan SR. It's indicated for the same. It's arrhythmias and hypertension. Some of the side effects are edema, constipation, gingival hyperplasia. And y'all, my southernness may be coming out, so if you hear me pronounce some things that are a little bit of a twang at the end, that's my southernness. Okay? You may have other people pronounce them a little differently, but here we go. We're going with it. Alpha-2 agonist antihypertensive, guanfacine, is the generic for the brand name Intuniv. Now, this is an interesting drug. The indication is hypertension, but it also has another indication, ADHD. Some of the side effects would be dry mouth, dizziness, fatigue, somnolence, impotence, and behavioral changes. And this one can cause rebound hypertension if you stop it abruptly. So this one needs to be really monitored. If someone were to need to come off of this, they need to take some time getting off it, maybe titrate down. Just good counseling advice. Now let's go into vitamin K antagonist anticoagulant, warfarin. That is the generic name for Coumadin and Jantoven. The indication for this is stroke prevention and AFib and VTE prophylaxis or treatment. This drug has some side effects and it has a lot of interactions. So let's talk about this for a hot second. Some of the side effects would be purple toe syndrome, bruising and bleeding, and skin necrosis. The increased bruising and bleeding is very likely, and you need to tell your patients when you do a consult with them that they may bruise very easily if they hit something or if they get cut. That is very important, and they need to actually consult the pharmacist, us, or the practitioner before starting a new medication or OTC product. This is definitely contraindicated in pregnancy, and it's used with caution in patients with genetic variations in VKRC1 or CYP2C9, 2 and 3 alleles. Now, it used to be that we would be concerned about the amount of vitamin K, the green leafies that people ate, but now we say eat what you normally eat a consistent amount of vitamin K products, and get frequent INR checks. So we can monitor how you're doing that way rather than telling you not to eat green leafies, and that's what you tell the patient. Let's talk about antiplatelet agents, salicylate NSAIDs. All right, so this one is aspirin, plain aspirin. There's a brand name called Ecotrin, and Ecotrin is a coated aspirin. It's an enteric-coated aspirin, thus the EC, enteric-coated. Pretty cool to know that, right? So it breaks in the top part of the small intestine. It's easier on the stomach, which is important. And the indication is secondary stroke prevention, stable ischemic heart disease, and some of the side effects are dyspepsia, heartburn, and bleeding. And this drug is important to monitor with other drugs that increase the bleeding risk. And if people have a salicylate allergy or an NSAID allergy, you don't want to take this drug. Also, children and teenagers do not need to take this, especially when they have a virus, because of the risk of Reye syndrome. Very important. P2Y12 antagonist antiplatelet agent. This is Ticagrelor. The brand name is Brilinta, and this is used for acute coronary syndrome. Some of the side effects, as you would think, because it's an antiplatelet agent, bleeding and dyspnea. You need to make sure that the patients know they want to make certain that if they take other drugs, we need to make sure that they don't increase the bleed risk. So if they don't know which drugs increase the bleed risk, which probably they don't, they need to ask you or their practitioner. Of course, the black box warnings, significant bleeding, and warnings and contraindications, active serious bleeding, and bleed risk. You want to back off of this one. There are other options. Here's another one, Clopidogrel. And this branded product is named Plavix. Antiplatelet, Plavix. Kind of cool, huh? So this is indicated for secondary stroke prevention and acute coronary syndrome. The side effects are bleeding. It can cause bleeding. They can interact with some other drugs that increase the bleed risk, and also you got to be careful with the CYP2C19 inhibitors like omeprazole and esomeprazole. That's important to look at those. That's where your pharmacogenomics comes into play. These have the black box warnings that say CYP2C19 poor metabolizers have a higher rate of cardio events since clopidogrel must be converted to an active metabolite by CYP2C19. And we can test for that now. You have patients that maybe aren't doing well, you might ought to think about that pharmacogenomics testing. Some of the warnings and contraindications are active serious bleeding and bleed risk, just like the other one. Direct thrombin inhibitor, direct oral anticoagulant, or DOAC is how it's commonly referred to as. Dabigatran etexilate. The brand name is Pradaxa, and the indication is stroke prevention and AFib and VTE treatment. Some of the side effects are dyspepsia and gastritis-like symptoms and some bleeding. This product needs to be stored in the original container. And again, this one also needs to be monitored with other drugs that increase bleed risk. One contraindication with this drug is contraindicated with mechanical prosthetic heart valves. Good to know. Factor Xa inhibitor, direct oral anticoagulant. This is another DOAC. Rivaroxaban. The brand name is Xarelto. And this indication is used for stroke prevention in AFib, VTE prophylaxis and treatment, and the side effects would be bleeding. And if you look at this, you can see some of the black box warnings and the contraindications, the active bleeding. Now, a note is this needs to be discontinued 24 hours before elective surgery. Here's another one, Apixaban, brand name Eliquis. It too is for stroke prevention and AFib, VTE treatment, DVT prophylaxis after knee or hip replacement. The side effect of this one is bleeding. But if you notice, the notes are the same except for you need to discontinue 24 hours before elective surgery with a low bleed risk. If you have a low bleed risk, you can stop at 24 hours before, or 48 hours before surgery with a moderate high bleed risk. This too, same black box warning and warnings and contraindications. Here's one, low molecular weight heparin, LWMH. Enoxaparin is a sub-Q injection and the brand is Lovenox. The common indication is VTE prophylaxis or treatment, and some of the side effects would be bleeding, anemia, injection site reaction, thrombocytopenia. And this comes in a pre-fill syringe and is so important to counsel your patients on this product. Let me tell you, sometimes when patients are discharged, or sometimes they go to the doctor before their surgery, and they forget after the surgery how to use it. And plus, they've been through anesthesia, they're home, if they've had outpatient surgery. So you need to have the patient, if the patient can come in, or their agent, and explain to them exactly how to give this drug. Somebody may have already explained it to them, but you need to go ahead and do it again. Reinforcement never hurt anybody. Let's talk about a vasodilator antihypertensive called Hydralazine. The brand name is Apresaline, and the common indication is hypertension, heart failure. Some of the side effects would be peripheral edema, headache, flushing, palpitations, and reflex tachycardia. This drug is kind of cool because it can be used to lower blood pressure in heart failure patients who can't tolerate an ACE or an ARB. And there are people out there, I know we talk about them being the best, but there are people who can't tolerate them, so this would be an alternative for them. The only thing is it's got a contraindication or warning that it can cause drug-induced lupus erythematosus, DILE. Nitroglycerin anti-anginal vasodilator. Isosorbide mononitrate. And if you look at the brand name, it's MDUR. It's kind of taken the I and the M, DUR. I think that's pretty cool. MDUR for the M for mononitrate. You've got another one that's going to be the disalt. So you want to make sure you know isosorbide mononitrate, MDUR. Okay? And it's indicated for angina. The side effects would be syncope, headache, flushing. Is contraindications and warnings is contraindicated with the use of PDE5 inhibitors and caution with hypotension, tachyphylaxis, and headache. And it interacts with PDE5 inhibitors. Did I say that one time? Very important, because you don't want to give these. And sometimes when you dispense the PDE5 inhibitors, people forget that they're taking an isosorbide, a nitroglycerin anti-anginal, and it's a vasodilator, and it's very highly contraindicated. So be aware, look at a profile. Another nitroglycerin anti-anginal, a vasodilator called Nitroglycerin XL. The brand name is Nitrostat. Now, it's pretty cool that stat means right away. Stat means immediately. And nitro stands for nitroglycerin. And it's used for angina or angina. You can hear it both ways. Some people say it angina, some people say it angina. The side effects would be syncope, headache, and flushing. And this drug needs to be stored in the original amber vial that it comes in. And this needs to be placed under the tongue and let dissolve. Now, if the pain continues after the first dose, you can still take 2 additional doses at 5-minute intervals, but I would go ahead and call 911 once I have to put that second tablet under my tongue. Do not exceed 3 tablets in 15 minutes. Very, very, very important. This one, too, is contraindicated with the use of PDE5 inhibitors. The next anti-anginal cardiovascular agent, ranolazine. The brand name is Ranexa. You can remember that because the RAN. Indicated for angina. The side effects would be dizziness and headaches. This one is not used for the acute treatment of chest pain, which the nitroglycerin that we just talked about is. This one is a little different in its warnings in that it can cause QT prolongation. And you're not supposed to use it with strong CYP3A4 inhibitors or inducers. That's important with your counseling. And no, patients aren't going to know what CYP3A4 inhibitors or inducers are, so we're going to have to look that up. We're going to have to do it for them because they would have no idea. So just be aware.